More and more people today are being misdiagnosed with type 2 diabetes because of some very outdated beliefs that type 1 diabetes only develops in childhood. That's not true. So when an adult comes in presenting with high blood sugar and symptoms of diabetes, it's immediately assumed that this person has type 2 diabetes. If an adult is overweight or obese, it's also immediately assumed that they have type 2 diabetes. No one ever stops to think that they might have type 1, but then also be living with obesity. The two can coexist. Getting the right diagnosis does matter because the treatment path for type 2 diabetes isn't going to be effective long term if you actually have type 1 diabetes. The symptoms of diabetes are mostly the same, regardless of what type you have. High blood sugar, intense thirst, feeling thirsty all the time, having to pee a lot, partly because you're drinking so much, because you're so thirsty, losing weight, even though you're not doing anything to cause weight loss, changes in your vision, suddenly having blurrier vision than normal, recurring yeast infections, which is because you have excess sugar in your urine. Ketones can develop in both type 1 and type 2 diabetes. They're more common in type 1, and just generally feeling tired and unwell. When type 1 diabetes develops in a child, it comes on pretty quickly. Insulin production is dropping very quickly, so the symptoms are very dramatic and very intense because insulin production has dropped really low and blood sugars are rising very high. When type 1 diabetes develops in adults, the symptoms tend to come on more gradually because insulin production tends to drop much more gradually. So the attack on the cells in your pancreas that produce insulin is a slower attack in most adults who develop type 1 diabetes. And there's a name for this. It's called latent autoimmune diabetes in adults, or LADA. Type 2 diabetes also develops very gradually. This is one reason why type 1 in adults can be easily misdiagnosed for type 2 if you don't get further testing. This means that adults who've developed type 1 diabetes can be treated with type 2 medications for even a number of years before anybody starts to see that these medications aren't working. They might work at first, they might work for a few months or a few years. Even though you're trying so hard to manage your blood sugars start rising and nothing seems to be helping. And you feel like it's your fault. You feel like you're not trying hard enough, you're not exercising enough, you're not eating the right things, when in fact it's actually because you've been misdiagnosed with type 2 diabetes and you actually have type 1 diabetes and your body's insulin production is declining more and more every year. Adults who are very lean and active and eat a healthy diet are also being misdiagnosed with type 2 diabetes. So if you are lean and this diagnosis doesn't make sense for you, you need to get screened for type 1 diabetes. Even your endocrinologist can be missing the right diagnosis. It's just this widely believed misconception that type 1 diabetes is a childhood disease. Recent research has found that more than half of new type 1 diabetes cases are being diagnosed in adults. I've met people who are misdiagnosed with type 2 diabetes in their 20s, 30s, 40s, 50s, 60s, and 70s. It happens at any age. Just because you're older or your children are older doesn't mean you're in the clear for developing type 1 diabetes. It can develop at any age.
I was misdiagnosed with type 2 diabetes. I am really glad I got the right diagnosis. Whether if I had type 1 or type 2, I just wanted an answer about which one I had so I could get the right treatment. Every person with diabetes deserves to know which type of they have so that way they can get the best care possible.
There are two very straightforward blood tests that you can ask for to determine if you actually have type 1 diabetes. The first is getting screened for the autoantibodies of type 1 diabetes. Autoantibodies develop when your immune system is attacking your own body. Thanks to decades of research, we can actually identify and test for T1D specific autoantibodies. If you have type 2 diabetes, you do not test positive for those autoantibodies. The second test is your C-peptide level. This indicates how much insulin you're still producing. If you have type 2 diabetes, your C-peptide level will be very high. If you have type 1 diabetes, your C-peptide level will be lower and lower and lower over time. If your doctor refuses to consider testing and screening for type 1 diabetes, go to trialnet.org and sign up for a free autoantibody screening kit. You take the kit to the nearest blood lab, they send your blood sample back to TrialNet, and TrialNet will tell you if you have tested positive for autoantibodies. Even though it stinks to be diagnosed with type 1 diabetes, it will be a relief because you won't be frustrated with why is this and this and this not working for your type 2 diagnosis. Getting the right diagnosis might be scary. You might be really reluctant to go and find out you actually have this autoimmune disease, but it's really important because the more years you spend struggling to get your blood sugars down, the more your nerve endings and your blood vessels throughout your whole body are suffering and experiencing damage from those chronically high blood sugar levels. Getting the right diagnosis is really important. Don't forget to subscribe, like this video, and leave a comment. Thanks for watching Diabetes Nerd. Find my books on Amazon.